Good morning. It is 9:04 and we're going to call the HHS meeting to order this morning. The first item on our agenda this morning is public comment. So if you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make public comment? Okay, would anyone like to make public comment? Seeing none, we will move on to approval of the agenda. Is there a motion to approve the agenda?
So moved.
Is there a second?
Support.
It's been moved and seconded to approve the agenda. Is there any discussion? Seeing none, all those in favor of approving the agenda, please say aye.
Aye.
All opposed, say nay. And the agenda is approved. So moving on to consent resolutions, we have one item under our consent resolutions, which is approval of the proposed minutes from the August 2024 Health and Human Services Committee meeting. Is there a motion to approve the consent resolutions?
So moved.
Is there a second?
Support.
So it's been moved and supported to approve the consent resolutions. Is there any discussion? Okay, seeing none. All those in favor of approving the consent resolutions, please say aye.
Aye.
Opposed, say nay. And the consent item is approved. So then, as we have no action items for this meeting, that moves us to our committee reports, where we will receive updates from several departments. And we will begin with Jennifer Brzezowski from Community Action Agency. Good morning.
Good morning.
Morning.
So a couple updates from Community Action Agency. Last time I was here, we were on a pause with our utility assistance program, so we got caught up. And that is back open, indefinitely as far as we could see, unless we have another uptick like we did last time. Just some numbers. This is a couple of weeks out of date, but we've had around 271 successful utility assistance appointments this fiscal year, which has been great. Something else I wanted to plug that we've had kind of a little bit of a lull is our Semco Full Pay program. So that is a program, obviously with Semco customers, that we can assist with non-functional furnaces or water heaters. So we'd love to be able to help people out, especially as we enter the fall season. Eligibility is 200% of federal poverty, and individuals can go either on our website to apply, or they could call us directly or email us. All of our information is on our homepage on the website on the right-hand bar. So if there's anybody that's interested in that program, we're happy to help. The other thing that we've had a little bit of a lull as well is our weatherization program. And I think it would just be helpful to, give some facts about the program, maybe some misconceptions. So the program's year round. So people might think, well, summer, why would I need weatherization? It works both ways, right? So if your air conditioner cooling your home and you don't have good airflow or too much airflow, then you're obviously losing everything that you're putting into your home. So again, it's a year-round program. We can work on homes throughout the year. We can receive applications throughout the year. And just some really cool feedback, some things that we heard from some homeowners and renters about the program that we didn't anticipate. So aside from just saving in their utility costs, we've had some people report that their house was quieter. So some things you don't really think about, right? With insulation, you might have, might be easier to hear in different rooms or outside of the home, but when we're insulating, we're able to also quiet down the outside noises from the homes as well. We've had some customers report that they were really worried about the winter time, but because of weatherization, they have less anxiety about their bills coming in the winter. We had an individual whose refrigerator stopped working. So we were able to replace that with the weatherization program. I should mention that's not a guarantee. So it depends on whether or not it's truly needed or not, and not energy efficient, but we're able to go in and replace those. We've been able to remediate knob and tube. I was surprised to hear that because it's, 2024, but we do have some, quite a few homes that have knob and tube. So we can actually go in and have that replaced as well. Um, And we've also been able to do a lot of repairs with plumbing leaks. So through either weatherization or our water program, we've been able to find and remediate some minor water leaks in the home, which is not only a cost savings for water, but then if we go in and weatherize, then we're also helping with gas and electric bills, which is amazing. So just overall, I think it's just helpful to know that um, when we're helping with weatherization, we're able to allow those homeowners and renters to put money back into their pockets instead of going to the utility companies for gas, electric, and water. So we're excited to continue to receive those applications. We do also work with apartment complexes of units 4 or less. So if the landlord is on board with it, we can do rental units as well, as long as the majority of the renters are income eligible. So we are happy to help with that. We do mobile homes. We do a lot of mobile homes in the area. And then, of course, we do single family homes as well. So we would love to receive more of those applications. And again, on our website, right on the homepage on weatherization, individuals can fill out an application. If they are not tech savvy, they are always welcome to give our office a call. And you can also email. Again, all the contact information is right on the homepage. And we're happy to receive applications year-round for that program. We have thus far weatherized, and again, might be slightly, we have 35 jobs in progress, so things are always moving quickly, but we've weatherized over 46 homes this fiscal year so far, but I anticipate that being quite a bit higher by the end of the month. So we were working hard this year and excited to receive more applications for the coming year. Any questions?
Mr. Minema?
Morning.
Good
How are
morning.
you, Jennifer?
Good, how are you?
Very good.
Good.
Just wanted to ask, I think I know the answer, but when you talked about the apartment complexes, the 4 or less, do they all have to meet income eligibility to be considered for the program, or can just one of them in that, if there were 4 that
Sure.
live there, can only one of them meet the eligibility guidelines and then they would be eligible?
So it's the majority. I know this is going to sound strange, but I believe the percentage is 66%, which doesn't make sense for, units of 4, but that's more of the larger complexes. So essentially we need 3 out of the 4 to be eligible. I think it might be slightly different. I wish I had my program manager here to rely on, but I think to be safe, it's 3 out of the 4. I
Okay.
think for 4, they may make an exception of 2. I'm gonna look into that and email you back because I want to have the accurate information.
Okay.
Yeah, let me do that.
I just
email you.
wondered.
Yeah, that's a great question. But I know it's at least 2 out of the 4.
Okay, thank you.
Mr. Cosby?
Yes, so, and congratulations on some of 271 utility assistants.
Thanks.
Do you know numbers from years before, just to get an idea of
I think
how much of an improvement that is?
might be, I think what I have broken down is by grant.
Okay.
So I don't know that I have, let's see.
Even an approximation, and if you don't have it offhand, that's okay.
If I could do that math that quickly, I would be happy to give you that number. The one that I have from the previous year totals some other programs that aren't necessarily utility assistance. But what I can tell you is actually, let me look at this one. So for MEAP specifically, the Michigan Energy Assistance Program, and that's the one that we saw the huge uptick after DHHS closed. We were at 39 assists, and that was end of August. The entire fiscal year last year was 18.
Wow.
And then try to see if I could have a good comparable. Like Zealand Board of Public Works was actually a little bit lower this year, so we've been working with them to make sure their customers know. So we're sitting at 15 for fiscal year, and there were 31 last year. So unfortunately, I don't have the total in front of me, but I can get that number to you as well. I should say though, we had quite a bit more Walk for Warmth assists last year. So we had 225 assists last year. And then 61 thus far this year. And the reason is because we put a bit of a pause on that due to what we had funding wise. So that's all donated funds, of course. And the reason why we had so much more in the last fiscal year is because we had the COVID CARES dollars. So since we had such a surplus of CARES dollars, we weren't tapping into Walk for Warmth for, I think, 2 or 3 fiscal years. So we were able to spend that. So it's hard to say like overall with utilities because each funding source is a little bit different. But I think that MEP is probably the biggest, like the best indicator to see that rise that was over double what we saw last year. I hope that helps.
Does.
Okay.
Definitely. And then your weatherization, you talked about even replacing knob and tube electrical under that. That's expensive.
It is expensive.
Yeah.
So we have several weatherization grants, and one of them is called the weatherization deferral dollars. So when we would go in previously and saw knob and tube or a plumbing leak or a roof leak, we would previously say, I'm sorry, we can't weatherize this home. It's a safety hazard, or it wouldn't be beneficial to come in and weatherize this home. Because we have those dollars, we can go in and do those projects. So that's, yes. So to answer your question, yes, it's expensive.
Yeah.
I mean, there are situations where if it's too expensive, then we would have to walk away. But we've been able to do several knob and tube projects and help those families out because that could be a huge safety concern.
Absolutely. Absolutely. So you do still have funds though in your weatherization program?
Yes.
Good.
Yes,
Good to know.
we do.
Thank you.
Thanks.
Mr. Moss.
Morning.
Good morning.
So we've been doing a lot of work on budget, not in this committee, but in finance and at the board level. Could you just kind of share just briefly, like some of your funding sources and some,
Sure.
especially like this new one, is that new this year and how's it going?
Yeah. So weatherization deferral came January of 2024. That is I believe it's a 3-year grant. So that's one of the funding sources. We also have Department of Energy. And that actually just started over again. It goes July to June. And last fiscal year, I believe I mentioned it before, but we were able to spend out almost the entirety of that grant. We also have LAHEAP, which is Low Income Household Energy Assistance Program. And then we have BILL, which is Bipartisan Infrastructure Law Grant as well. So it's all been going very well. I don't know that we're projected to spend out all of those funding sources in the coming year. But essentially the way that it works is what we're not able to spend out. Some of it gets rolled into the following year, depending on the funding source. And thankfully we haven't had to have it redistributed throughout the state because we've been pretty successful in our weatherization program to get a lot of those houses weatherized. I hope that helps.
Yeah, that's great. Yeah. The deferral, is that a state grant?
That's through Department of Energy as
Oh,
well.
it is. Okay.
Yep. Yeah.
Thanks.
And I think it's helpful to know too, we have over 23 funding sources in our small agency. So that's why it's a little difficult to keep it all straight sometimes. So
Yeah.
How many people work for your department?
there are 8 of us.
8 of you.
Yeah.
That's a lot to manage.
It's
Yeah.
a lot of juggling that we do. Yeah.
Mhm.
Yeah. We have an amazing team. So I think that's how we're able to make it happen every day.
Okay, do we have any other questions? All right, thank you.
Thank you.
And I just want to acknowledge that Commissioner Zylstra is also with us online. So Commissioner Zylstra, could you tell us where you are calling in from or joining us from?
Sure, I'm joining you from Holland, Michigan.
Thank you. So next up, we have Jason Schenkel from the Department of Veterans Affairs.
Good morning.
Good morning.
I'll be brief this morning. We didn't really talk much about our resource fair in August, but it was a huge success. I got numbers back from the federal VA. Year to date, we were the second largest stand down and resource fair in the state. So
Wow.
with over 65 organizations and over 160 veterans who attended. So currently working with Jason Shamlin in the Parks Department to look at some locations for this spring. We'd like to host it actually at one of our county parks.
Nice.
So I'm going to go out with Jason and we're going to look at some sites for that. We had 2 electric wheelchairs that were donated to our department. We actually were able to redonate one yesterday, so we paid one forward. So which is absolutely awesome. September 27th from 8 to 10, we have a Veterans Coffee and Donut Outreach event that's going to be hosted by the Holland VFW. September 18th, I'm presenting at the CMH Lunch and Learn. Our grant for FY25 was approved, and we're currently working on wrapping up all of our FY24 reporting for this year's grant. Some numbers from August. Transportation with 17 rides, we had 3 burial allowance cases, 4 committee fund, and 1 Michigan Veterans Trust Fund, and 69 VSO appointments. So the funeral allowance was 900. Committee fund, we were at $2,944.99. And the Michigan Veterans Trust Fund case was $3,500. So other than that, that's really all I got for you.
Mr. Moss.
Morning.
Morning.
How are the VSO appointments going? Are they increasing, decreasing? Like, what are you seeing there?
Yeah, we're staying right about the same. So the VFW brought in another VSO from Muskegon to cover a day in the Holland. So we do have that replacement coverage for right now. Our Vietnam Vets of America representative has given us an additional day as well. She's now coming in on Thursdays. So we have 5 days of VSO support right now. So, which is good. Whether or not the VFW does a full-time replacement or not, we won't know until probably October 1st when their grant kicks in to replace that role. So
Okay.
we're doing well. I've been doing some cases as well. Dwayne, my assistant, goes through accreditation training next week
Great.
for his accreditation. So we got some folks that are be able to handle that increase. So, yeah.
Thank you.
Mr. Medema.
Morning, Jason.
Good morning.
Can you please restate the donut event that's by the VFW?
Yeah, that's going to be September 27th from 8 to 10
And where's it going to be at?
at the Holland VFW.
Okay. And then the lunch and learn, what time is that at?
September 18th at noon.
At noon. Okay. And what location?
That's going to be at CMH.
At the CMH. Okay. Perfect. Thank you.
I think we got popcorn.
Popcorn. All right. Perfect.
Is that open to the community then for
We'd-
veterans?
We'd have to have the doc back there.
Yep.
Yeah.
Yes. Okay. Thank you.
Looking at last year and this year, can you tell it all data wise? Is your service levels gone up? Do you have any year-to-year comparables?
I don't,
Okay.
not today, but I definitely, within the next couple of weeks, I was going to do an FY 23, 24
Great.
comparison. But I will tell you, we're doing a lot more. We've spent more in emergent funding. At the county level, we've spent more with the state Michigan Trust Fund. We've kind of leveled down a little bit with transportation, but that's seasonal as well. Once we start getting into the winter months, we'll have more veterans, especially our elderly veterans that'll want rides. Our VSO appointments are roughly about the same. But so I'll do a full end of year for you guys next month. But I
Okay.
can send some stuff out as well.
Great,
Yeah.
great. And so with the VSOs, do you have any continuing needs then as far as continuity of who's looking at those cases? Um, It sounds like there's maybe been some changeover in who's there and who is available for you.
Mhm.
So does that continue to be a challenge or you feel like you have that covered?
No, it's a challenge. Yeah, couple of things with that. One, we've talked about it before, is since they're not, um, they don't report to me, they're not county employees, so we're subject to whatever that organization deems necessary as far as their staffing goes. The VSOs are actually funded through a grant program through the state of Michigan. So if the VFW, the Legion, the VVA, the DAV, they have to ask for that grant money. So if they're not asking for the staffing, then it will trickle down effect to us as well. And then as we dig in and we do a little bit more of a data analysis, we see where our cases are. Um, Really what we're trying to accomplish is really limit the amount of time it takes for people to come in and see us. So even though we've ramped up, we're only averaging the same amount of appointments per month because that's the only staff that we have available. But our appointments are being pushed out further and further. So now we're 3 weeks, sometimes even 4 weeks out with appointments. So with additional accreditation and staffing, we'll be able to reduce the amount of time. That's always a big frustration within the VA system is if it takes me a month just to get into do an intent to file for a claim, and then that claim can take up to another year to be completed by the federal VA. So the longer we take to get them in, triage what they need, put a claim in, we're adding additional time and um, anxiety and, some folks need assistance as soon as possible. When you look at the elderly population, when we do claims for like aid and attendance or homebound services, some of these folks don't have the time to wait. And not to have a bummer conversation, but I mean, we've had a few that we've lost in that time period where they didn't get the resources through claims and benefits and passed away before we were able to get them taken care of because they're in facilities or home care that they need. So it's right now, it's not so much about how many claims we're processing, but it's about how much time we're pushing those out. So if we could be a little more effective and efficient in those processes, then it would be helpful.
Mr.
That-
Cosby?
Yeah, that might be actually, if you look at a dashboard, for instance, that might be turnaround time,
Mhm.
for, VSO appointments, I think would be something good to track. Because then we can kind of, or next board determine staffing required to do that and how we support you.
Correct. So another thing too is prior to me starting in this role in January, Vetrospect, which is the federal system that the VSOs use for claims, they were utilizing their power of attorney organization, and then they were just using a standard location. Now that we have them using Ottawa County, now I can go back into Vetrospect and see those claims and how many we've claimed, what types of claims. I can see the demographics of the claims. Before we didn't have that. So even this year's data is going to be a little dirty because I got in here halfway through the year, but next year we'll start with really some cleaner reporting, be able to pull that data out of Vetrospect, even to the point where when we did the resource fair, we didn't really have a lot of uh, contact information, emails, phone numbers. But now that we got that switched in Vetrospect, I can now pull those individuals that are in that database. I can get their contact information and be able to provide them with, information about coffee and donut events or our resource fairs or newsletters or any big VA information that comes down through the pipeline. I can now push back out. So, and then also at the end of the year, those VSOs will be able to report back to me, how many claims they filed, what type of claims they were.
Nice.
And then again, the demographics, right? We can look at the age of our veterans, how many surviving spouses that we may have helped, dependent information. We're getting a lot of calls now in reference to education, and how folks can utilize their education benefits, how to transfer it to dependents. So, yeah, we're doing a lot with the bigger scope. And then obviously we're going to move into our employment sector too here shortly. Start talking about jobs and resumes and placements.
Excellent. It's too bad they don't have a triage component to that, to hear that you're losing people or people not getting services. Yeah. That's unfortunate.
No.
Went triage out of the military.
Yeah,
So,
yeah.
we should be able to use it from a complaints perspective or requests for services perspective. Yeah.
Mr. Minema.
How often, so Jason, when someone gets seen for their first time for a VSO appointment, how often does that continued? Are there more meetings after that? Or are most of them just a one? Like, can you help me understand a little bit, like once they go finally are able to get seen, what does that look like for a veteran or their family member after that?
Typically it's two. So the first one really is a get to know you meeting, understand what your needs are, and then whether or not you're qualified for whatever resource it is that you're applying for. Usually the second visit is additional documentation, evidence, really depends on the type of claim. I have one Friday, daughter and her mother, who's a surviving spouse, will be coming in. So really it's the first one is kind of that triage. What do you need? What are you qualified for? What supporting documents are going to be needed in order to file the claim? What evidence do we need to gather? Let's say if it's a service-connected disability, medical records from every doctor that you've seen for that ailment. Then once all the evidence is brought together, then we actually do the formal claim. It usually starts the first appointment with an intent to file. And an intent to file really just locks in that date. So if we say today that Jason's going to have a service-connected disability, we do an intent to file that locks today in. 9 months from now, the VA approves it, it will be backdated to the intent to file date. So most initial appointments will always start with an intent to file. There's usually 2 to 3 follow-ups depending on the type of case and how much evidence and documentation is needed.
Do veterans have to wait an extensive amount of time between appointments, or once they have their initial one, they're kind of locked in to, I guess, a more timely meeting?
No, they get right back on the calendar like everybody else. So,
Okay.
yeah.
So it goes back to kind of like what you were saying, that at the moment, 3 to 4 weeks out. So then that would start the next one. So now they have to wait another additional 3 to 4 weeks for their next meeting.
It can. Yeah, in some cases we have phone calls and have that conversation. Depending on the documentation or the evidence, they can just drop it off to us. They can email us. In some cases, depending on the documentation, it has to be a secure email because we have PII that we're dealing with. But yeah, we're usually the second appointment's fairly flexible. We've done a few Teams meetings as well, some video conferences. Yeah.
Thank you.
All right, any more questions? Okay, thank you, Jason.
All right, thank you.
All right, next up, we have Dr. Michael Brashears with Community Mental Health. Good morning.
Good morning. Yeah, ahead of me. Good morning, everybody. A couple of things. First, you should get, first thing I'm going to review is just my director's report that I provide to the CMH board every month, just some highlights. And then I'm going to go through a couple of slides of the educational series we started last week, 2 weeks ago, for you to see. As you're getting the handout for the executive reports, I won't read all of it in detail, and it will be added to the packet permanently. So at the state level, there's been a lot of activity in terms of MDHHS enforcing this conflict-free access and referral, and to remind this group, that means an organization can't both assess and authorize service and provide a service. You'd have to have a tremendous amount of firewalls that go through that. In Ottawa County, since we directly operate several of our programs, this is fundamentally a threat to the way our model is structured. Well, I attended a director's forum last a week ago, I believe, in Lansing, and they've put that on hold.
Okay.
So we'll see what the federal government says, but it's on hold, kind of like nothing to see yet, but I am preparing. I'm hoping for the best and we'll plan for the worst. So if that happens, I'd have to find a way to fundamentally within our CMH department as a county department, deal with directly operated county employees in the same organization as a group that authorizes it. I have ideas. We will be able to get through it if it happens, but I'm keeping it on the radar. I know you have a lot on the radar as one of the existential threats to our model here in Ottawa County. We're about to re-sign a contract with the regional entity, and that is the body that we're members of that authorize and manage the close to 80% of our budget, the Medicaid budget, actually over 80%. Corporate counsel has been looking over that contract, and I'll be bringing that to my board for review this month, and then we'll go ahead and execute it. This is the bulk of our funding. And if you remember the structure of the CMH, which I'm going to go over in a moment, they authorize and manage like a managed care company, all of the Medicaid dollars that we have. In a couple of minutes, I'm going to show you a slide of how that breaks out. Other internal things, I'm continuing with my residential services review of our rates for residential providers. Residential expenditures is 1/3 of all of our expenditures at CMH. Over $20 million just to put people and manage people in residential care at all levels. In a couple of months, I'll come before this committee and go through the different types of residential care we provide and the fiscal impact and implications for each one. It's a huge system going from mom and pop type of settings to very high behaviorally focused residential settings. And I've been getting my hands around that particular system within our system because it's the biggest part of our budget, frankly, and we have to manage it. Other things briefly on this report. Okay. Sorry. I've been doing a focus on youth to adult transition internally, meaning when somebody's a youth in our system, CMH system, or at the intermediate school system, what type of services and options drop off or don't drop off when they're 18? I'm very concerned there's like the tale of two cities. You're being served by CMH when you're a youth, then all of a sudden you turn 18 and there's a different criteria to serve you. And I want to ensure that once you're part of the family, you're in the family. And there shouldn't be a huge drop off of services based on age alone. So we're looking at how that's happening within CMH. I'm doing a systems look. And on the last page of this document, you'll see the phases I use in the systems look, not to get too performance improvement focused, but you'll see that I use a fundamental model I call FOSP. The first thing I do is I look at a foundational source review of what we're obligated to do. Then I look at the desired outcomes of what we want, then the systems and processes associated with that. So I have like a FOSP analysis going on in many sections within CMH to ensure the community that we are providing what we're obligated to do. I've had the privilege of last couple of weeks doing we're calling it Did You Know? It's an every Friday from 12 to 2 educational series open to CMH board commissioners and the public about different aspects of the CMH system. This will happen every Friday. There might be some cancellations because I'm not going to do 52 of them, but I'll do over 30 of them for sure. And what they'll do is it will highlight a specific aspect of the system and entertain questions. The first 4-part series has been on our funding stream. And what I'd like to do is just show you a couple of slides of what we discussed last week so you get a sense, and the public gets a sense of how I'm going about it. Can I switch this now? Is it already there? In Boston, we call it a clicker, but okay. Okay. All right. So each one of these sessions are open to the public, and we were able to do this. Oh, I can look without my glasses. All right. So the purpose every single time I meet, as I go over this with the funding streams, is the structure and process of CMH, an overview of a funding source, and a general overview of state mental health general fund was this particular focus. So each one of these meetings, I start off with a couple of slides like this. What you're showing here is really presented to basically say that in the mental health code, the CMHs, or what we're called CMHSPs, are the only entities by design that can manage and provide the public mental health services. Regardless of the funding source, regardless if it's Medicaid, we by statute are the only organization that can do what's required in the mental health code. And that's important because you'll often hear threats of privatization. Well, it could happen if they actually change the mental health code. So your CMH department is mandated by law to be the only entity in our county, unless we kind of do things with other counties, but our county, to deliver the system, and that's important. We are the safety net. And then I go through in this, and you have a copy of it, the role of the state is to make sure, it's the bottom bullet, state shall financially support in accordance with the mental health code what we need to do so. It's my belief that is not happening. That I do not believe the state of Michigan is meeting their obligation, especially with state general fund, which I'll show you in a moment, to fund the CMH system appropriately. Now, of course, the state would disagree, but we're putting together an analysis to demonstrate that our utilization and need for service is greater than the funding we receive. And it says the state shall provide financial support. And it actually says in another section, it shall provide adequate financial support to meet all the obligations outlined in the mental health code. So when I'm doing these meetings, the community has come and they've been like, wow, I could advocate for you. I'm like, you bet. Well, I could be saying, are you funding our CMH appropriately? Well, for me to answer that question, I still have to complete my examination of how we're spending the money, how efficient we are, and if indeed is the case. So I have a hunch of what the answer is, and I'm very systematic in how I go about these things. But it's my belief already, looking at the residential system, we don't receive enough money to manage it adequately. I'll take questions on it in a moment. This next slide is to show you that the county is financially liable for 10% of the net cost of any service that is provided by us. So regardless if it's Medicaid or general fund or any of these funding services, if we overspend significantly, then the county first has to match 10% just to pull down Medicaid dollars. We're all in this together. We're in a shared risk agreement with that. But I like to show this because sometimes the public doesn't know that every county, regardless if the CMH is a county department or not, is obligated to do a 10% match to pull down state general fund money for mental health services. And for us, I'll show in a pie chart in a moment, it's around 400 and something thousand of the match we do. And it tells you some other services we have to provide. And again, this is not meant to be an exhaustive examination of my presentation, but show you the types of things we're covering so that if you're interested, you'll come. So here's how the CMH system is structured. And this is purely on the Medicaid side. You have CMS at the top in the big blue, as I call it, go blue, right? Then they fund the money down to the state of Michigan, go green, right? They're right there in Lansing and East Lansing. In a series of waivers, Medicaid waivers. And then that gold box, gold, blue and gold, is where the LRE, or what's called the PIHP, or the Lakeshore Regional Entity in our region, they're the entity that stands right in the middle of our Medicaid funding. And you'll notice there's 10 of them throughout the state, and we belong to a particular region that has other CMHs in it, right? I'm showing you this because after that is the 46 CMHs, which we're a part of, only 5 are county departments. The rest are standalone. And then finally, the funding gets down to the folks, the people that actually deliver the services or direct arrangements. And, you know, there's a bureaucracy for a reason, but literally the money flows from the top all the way down. And the time it gets to the actual delivery of services, there's been an administrative cut on each of those levels. I'm all about maximizing the amount of money that goes for services and the folks. And so we're looking at this arrangement and how to make it more efficient, both regionally and locally. Can't do much at the state at this moment. But that's the structure of the CMH system. There are 10 regional kind of managed care organizations, which 46 of us report to one of those, and then it goes down. And the Medicaid flows down. When you get to general fund, I'm almost done, I promise. Okay, wait, so this is the pie chart that shows you exactly how our money is situated. Now, my finance person says these numbers change, but this is rough and minus where we're at because it's a moving target every year. The big blue Pac-Man is the Medicaid funding. And you can see the percentage of that. That means the state of Michigan has chosen to use Medicaid primarily to meet its obligations in the mental health code that I showed you as the primary funding source. Now, what the commissioners need to understand is that's just a choice. All of their obligations to the system are still there regardless of the level of Medicaid funding that they get from the feds to pass on to us through a match program or what our region decides to give us. And I intend to keep reminding folks of this because over 10 years ago, there was a massive reduction of CMH staff due to a massive reduction in Medicaid funding. We lost close to 1/3 of the workforce. I don't intend to let that happen ever again unchecked. I will be fighting to ensure that Medicaid funding is appropriate to our need. We should have never experienced a dramatic Medicaid cut, regardless of how many Medicaid eligibles we have in our county. That's how they base it. Because by statute, they are obligated, regardless of their choice, to fund us appropriately. And so I show you this, and I show you I have an arrow where state general fund is. That's the mental health dollars we get due to our 10% match from the county. And you can see the County of Ottawa's slot. I wish it was bigger, but it's there. It's around $400,000. So currently, Ottawa County gives the CMH department this and a little bit more in some areas. This is the financial footprint that we have through county allocations. And I know there's another committee meeting afterwards. And you look at the finance committee handouts, you'll say amount of money that's taken from the general fund for CMH, it's zero for us. So your second largest department is getting 400,000 plus from the county only to meet a $72 million obligation. Why? Because we're all participating in the use of Medicaid and the use of state general fund to make this happen. But the public doesn't know that. When I go through that, they thought that CMH was 100% funded by the county. And so I've had to educate folks to that. Now, I believe in using every other funding source you possibly can before you tap into state or county general fund. Those dollars need to stay precious for our county. But I just need the folks to know that this department is funding itself, and even with the Medicaid dollars, and even paying the county money for services we get. So when I go through the pie chart, that's the questions I get. I just want to make sure people understand I'm talking about it. So it's been a blessing to do some of these educational seminars with the public. Anybody's welcome to come to them. Next Friday or this Friday, we're focusing on the ever elusive CCBHC funding, or Community Care Behavioral Health Clinic, or Certified Behavioral Health Clinic we have, and how that funding works and what services are connected to it. That'll be 12 to 2 on Friday. Now, all of these are being recorded. I'm in the process of adding narrative and will be posted on our website. So if folks can't come, they can hear me talk about the slides and some stuff. I was going to make it a Zoom opportunity, but we spent half the meeting trying to reconnect people to Zoom and turn off your mic and all that, and I forget it. So what I'm going to do is just post narrative recordings over the presentation and have that available on our website starting next month. Last thing I'd like to say before I entertain any questions is last week I was honored with a reception sponsored by the county. Come meet Dr. Brashears in his new appointment. I want to thank the county for having that opportunity for people to come and meet me, and I said a couple of words. It was a very nice gesture and I very much appreciate it. And I'm hoping we have more things like that, getting folks together meeting together, just getting to know each other. It's one part of the county that I want to get more involved in. So it was very nice to have that reception and have people from any county employee come. We had the public, we had state representatives come primarily, and my staff, but it was a nice gesture. So I threw a lot at you. Any questions?
Mr. Moss.
Sure. Yeah. Thank you for the update. And especially in the residential system, learning about this is very, very interesting and helpful, but it's also important. And I appreciate the continued focus on budgetary control,
Yeah.
both short-term and long-term, especially as we're planning to meet, obligations. And these are for individuals, for people who sometimes are in desperate need. And you mentioned that safety net. I just want to say thanks. And I really appreciate the focus on the budget.
Thank you. Welcome.
Mr. Minema.
Morning. Thanks for being here. Just wanted to first say thank you for the lunch and learns that you are doing. I'm glad to hear that you are working on having them available on recordings. I know I actually already looked for them because I haven't been able to attend at this point. I think that will be very beneficial for many. I would encourage you, if you haven't already, to possibly work with our communications department and make sure that that gets put out there once it does get uploaded to the CMH website, so that people are aware that it's actually there.
They actually came, took pictures of me doing it, all kinds of stuff. So,
Great.
how many blue and black blazers can you see me in a month? But yeah, we've been doing
Okay.
that.
Great. Thank you.
Great. Mr. Cosby.
So with the specialized residential services, do you know approximately from total consumers that we serve in the community, how many people are actually using those services?
220.
220. And it's
Which
one
at
third
close
of
to
the
$20 million
cost?
a year.
Wow, okay.
They're very expensive. Our rates range from $1,400 a day down to $40 a day in different settings. And the $1,400 day is definitely an outlier. We've been addressing that. In fact, they're going to reduce their rates by 40% after us meeting with them. There was a long history with it. But looking at the rates across the different settings and coming up with the formula of what's fair to cover the basic cost of direct care workers plus a little extra has been my focus. And what's emerging across the board in CMH, we have a lot of the services, a lot of different ranges of rates. That's when you look at them at first go, this isn't logical. And then you spend the time going through the detail and go, well, I could see why we're there. So I use what was the past, what do we need now? And what's the future? And the future is a much smaller range of rates based on a logic model that requires constant auditing and checking in. Does that person still need that level of care? But it's around 220 people, around $20 million, primarily in the DD population, developmental and disability department. We have very few children or adolescents because of the way the system is structured in residential care, because they're usually doing that outside of our system. I think we have like 2. But yes, and then next month, you're going to see the new, I'm creating a dashboard for this group from the information. How many people we're serving, what was the change from month to month, how many crisis contacts we had, what led to hospitalization, what didn't. So you get a sense of how that safety net is working, and to help deal with things like CMH doesn't let anybody in. So you'll be able to look at the stats and go, well, out of 100 evaluations, 97 of them got in. And then what did they get? So I'm hoping in October, we should be done by then, to have a dashboard that's always public, but to bring to you every month to look at, in addition to my basic.
Yeah, no, thank you very much, because the things that you've identified here, the issues you've identified here are the ones that constituents actually brought to me when I was campaigning. And then even as a commissioner, I'm really pleased to hear that you're working on the youth to adult transition. And just kind of what the plan is from age to 18 to 26,
Yes.
correct? With OAISD being sort of a
Yes.
supportive mechanism that's in there. But I am wondering if that will decrease some of the crisis moments that we encounter.
I was happy to find out that when I started looking at that age group, especially in the IDD side, that almost a fourth of who we're serving are 18 to 26, over 126 people. So I was like, wow, we're kind of serving them. So now we're like, how are we serving them and who's in the gap? Right? And of course, with CMH, you all know this by looking at this pie chart with Medicaid, by the way we get that money is in 12 installments, regardless of how many people we serve. I hate to tell you, there's no incentive for CMH to find new cases, none whatsoever, from a financial standpoint. You don't get, oh, you served 100% more last year, so what? Here's your allocation. This is a fundamental threat to access when the funding isn't fee for service. If it was fee for service, we'd be scouring the countryside looking for people because you only get paid when you do something. So we're looking at this as an opportunity, but I started, Gretchen, that, Commissioner Cosby, excuse me, that investigation, as you know, 2 months ago, and I said that was one of my focuses, 18 to 26. And I did get to meet at Compassionate Heart Ministries with over 40 parents that told me similar themes. And so we're looking at that very closely.
Thank you.
Wondering when you are looking at things on a state level, it seems like there has been more focus in recent years to shift money towards the schools and mental health in schools. How do you think that's part of the funding changes that you've seen?
In the governor's budget, in the last budget, that was the case. Actually, they reduced the amount of mental health in schools, but still there was a movement towards moving the money to other entities that provide services. And so, we need mental health services everywhere, right? The school is a vital partner, but it's my belief that the primary responsibility is the CMH department for these individuals and families. Schools need support. Believe me, they need support. But we have to be the strongest partner so they can focus their attention on the other things they have to do as well. So a lot of the school funding is in the identifying, supporting, walking alongside adolescents and children that may display symptoms. But I want to make sure we have the connection to have them come to us. I'm not a believer in developing a comprehensive mental health system within a school. That's what we're here for. So working with schools. So if we're doing our job, schools can be supportive and do their job, and we're bringing folks to us and we can come to them. But the current administration at the state level is seemed to forget to put the money where the rhetoric is in terms related to mental health. They talk a big game, but we haven't had a substantial increase or even at all in the system for quite a while, and the requirements have gone up exponentially.
Yes, and I would just note too, I think that, one advantage of having the core services happening through CMH versus a school is that you have parent awareness and parent involvement on a level that I think is more possible through CMH than kept within a school system.
Yeah, parent choice
Right.
and disclosure. Choice of who provides the service and disclosure on how the service is being provided. So you've heard me in my CMH board meetings, that's the two anchors of ensuring parental involvement, so that they're involved, there's choice, but then there's disclosure of how we're delivering the services and who's doing it. So a parent can choose if they want that methodology or not. It shouldn't be, here's what we have, one size fits all, keep the parents out of it. No. So those are the two anchors that I help use to address that issue.
Okay, great. All right, any other questions? Okay,
Appreciate your
thank
time.
you.
Thank you.
Thank you.
Okay, next up, we have Adeline Hambley with the Department of Public Health. Good morning.
Let's see. I have a few program updates that should be of interest. I think first is the sustainability program. I know Kim's been in front of you a few times, and the changes to Part 115 and the materials management plan. That committee has been working on it. They've met, I believe they meet again this week, and they're working on a draft plan. The state, I think, has some deadlines that aren't completely realistic, but we're working toward that. And so something should hopefully a draft, probably a very rough draft of something will come back before this board in December for you to take a look at. You're free to attend those. I think Commissioner Bonema is the rep on that committee, but if you're interested in attending, especially if you're in an area that has a landfill, please feel free to do so. So our food inspection software is, we were notified that it's no longer going to be supported as of December of 2025. So the software that we purchased was bought out by a larger software company. I might have told you this already. And then have a different suite of products that are far more costly. And so they're phasing out this. I think they essentially purchased it to gain the customer base. And so they're phasing out what we use. So right now we're working on putting together all of the needs and working with purchasing to get an RFP out. But that could potentially be something that's comes in front of you to consider. I don't know that it'll be done by December since it's such a long process, but it should be soon, I think. So we can take some time to do that transition over before they cut us off from the current one. We also have reformed and started meeting again a food advisory council. It is made up of area restaurants, owners, and it allows them to have a voice in what they need for education, for staff, issues they're seeing. And so they actually work to create the agenda and lead the conversation. So that just started again, and we'll be meeting, and I can report back on that after it kind of meets for a couple times. But we're pretty excited to have some of the industry at the table to provide some feedback and insights. Foodborne illness reporting. There's some new technology in the works for reporting complaint. Right now, there's a big red button that's like if you want to form or file a complaint, and it's for foodborne illness and any other complaint you might have. The new complaint system will funnel to a system that we worked with the GIS team to build. And so people can type in the name of any facility and the GIS map will pull that up so they can click on it, whether they bought groceries at Myers or they ate at Burger King. They can select which one. And then it will lead them through questions about symptoms and what they ate. But the goal is it'll feed back into our GIS system so we can more easily see if there's a cluster of illnesses being reported in either for a specific facility or in a specific area. So we're pretty excited about that. Hope it will roll out in the next month or two. Let's see. I do have diseases again for you today. So rabies, I think that this happened after the last time I was here, so I didn't, I don't think I told you about this, but if I did, I apologize for hearing it again. But we did have a positive rabies, a bat. The homeowner found the bat on them while they were showering and brought it in for testing, thankfully, because it did test positive for rabies. So they went through the post-exposure prophylaxis. So if the more you know is if you have a bat that you wake up with, so it could possibly have landed on you while you were sleeping or in any of your children's rooms, please reach out so we can test it. And then of course, if there is a wild animal that is acting odd, like certainly it's unusual for a bat to crawl on you while you're taking a shower, definitely take notice. I think there's been stories of children being exposed because they'll find like a bat on the sidewalk and they'll want to pick it up. But that's of course very unusual behavior for a bat. So don't touch wild animals. And if you do have an encounter, let us know so we can test. There is no cost for the rabies testing. And then we work with Harbor Humane. They can bring any of the animals there. They do the euthanasia and packaging and shipping for us because they have rabies vaccines and vets on site. So West Nile, there was recently a neuroinvasive West Nile case in Kent County on September 10. And so, the public service announcement, if you do go outside, please use your insect repellent, long sleeves and pants, stay indoors during dusk and dawn. And then if you have like standing stagnant water, take care of that so you're not providing mosquito breeding grounds. So for the neuroinvasive West Nile symptoms, headache, body aches, joint pain, fatigue. Most recover entirely. About 1 in 150 will develop severe illness that can affect the central nervous system. So as much as you can do to avoid getting bit by mosquitoes, the better. And last, we do have a new, couple new reports on the website that may be of interest. There is a monthly reportable disease summary that just got posted for the month of August. We are seeing increased in respiratory illness reported, both influenza, COVID, and colds. So staying home or having your children stay home if they're sick, stay home from work if you're sick. And so you can see that report and kind of the trend of numbers. It is in the data and statistics tab of the public health page. There was also a GI illness report that was just posted on September 6th. You can take a look at, we're not seeing any huge increases or spikes in GI illness reported. But if you want to take a look at it, that was just posted as well. I do have one more thing I forgot. I wrote it out of order. So there was recently an MDART alert. It just came out yesterday. We posted information on our social media pages, so you can see that. But it's to not eat Hickory Knoll cheeses that came out of Hickory Knoll Farms Creamery out of Ingham County. However, they're sold at Farmers Market in Kent County, the Fulton Street Market. And the recall was due to unsanitary conditions and risk of illness. So if you have that or purchase cheeses at the farmer's market in Kent, you're urged to throw that out. But more information is on our social media pages. The reason I mention it is it's really unusual for MDARD to issue a recall. So when they issue a recall and say on sanitary conditions, it makes us perk up a little bit. And then it's so close. You have so many folks that probably do go to the Fulton Street Market to purchase. So I believe that's everything I have. Does anybody have any questions?
All right. Do you have any questions? Mr. Cosby?
Just, and thank you, Adeline,
Mhm.
for your report. Question for you. So influenza, COVID, and cold uptick. Is it unusual, like year over year? We're back to school right now, even like the GI illnesses. Is this something different or
Yeah,
pretty much
illnesses
on the
that we
same
usually
course?
see in the like norovirus. For some reason, we usually see that uptick in the spring. I'm not sure exactly why, because you would think with the congregating. But yeah, it's not unusual with everybody back to school. You know, like all the kids coming together again. They're really great incubators for illness for sure. So
So nothing atypical.
no, just higher than what we saw all summer, which is to be expected. Yeah. So buy your kids Kleenex. So they don't, like-
Oh, I just got back from seeing my grandbaby and yeah, she's sharing.
Mr. Moss?
Morning. Still morning. One random question, is there an age where, like a certain age where kids typically don't have those respiratory issues, like 0 to 12 months? Is that? Just curious, someone was talking to me about that recently, where if like a really young kid has that kind of issue, that it's more serious.
Yeah, they don't have the immunity built up yet. So it is generally, when like a baby gets RSV, tends to be so much more serious than an older child. I think, you think of all the times that you catch a cold or something else that's challenging your immune system to build up that immune response. But I would say that kids are definitely continue to have bad practices with touching their face and hand washing, that they continue to get sick. But yeah, the infants, younger children with lower immunity is definitely a greater risk. Yeah.
If they have siblings in the house as well.
Yeah,
Mhm.
Shared from 0 to 12, yeah.
well, that would make sense then.
Yeah.
Okay. Another question about that later.
Oh.
Not my house, by the way. It's a friend. One other question I had was, is there a new or changing infection prevention grant for this next year?
Yeah,
We're doing lots of,
so it used to be, I think that in the budget, you'll see it's $900,000. And that used to be very specific for COVID. And since then, that's been changed to just infection prevention. So we can use it for any disease like infection prevention response. So even our outbreak response. So I know if you remember back when we had the critter barn response,
Yep.
like we can charge all the time for anybody that went to the farm or did any of the work related to that can be charged to that. So it's not specifically or specified for COVID. It's any sort of infection prevention disease response.
is it possible that it will only be used like a certain amount if it's not needed?
Right. What happens is they end up uploading that into like our time cards. We have it to select down. And then if anybody is doing some sort of disease response, they're coding to it. So it is a little bit based on what we had. So if we had a large scale outbreak, way back when we had one that was like 400 people with noro and related to a single establishment. And there were so many people doing that response. Like, so if you have like large events, obviously it's going to get eaten up, but it is limited to specific activities for infection prevention. So potentially it wouldn't, depending on how healthy our year is, I suppose.
If there was overtime and things like that, it would cover any of those related expenses?
Yep.
Yeah.
Yep, mileage, anything related. Sometimes we have mileage and have to do sampling and things like that, like sample collection, any of that, like the shipping or expedited shipping for sample testing or lab costs, any of that.
Are there any like committed positions within it, or is it just for like,
No, but it's just
usage?
for offsetting existing staff's time for those specific activities.
All right, thanks.
Mhm.
Mr. Minema?
Morning, Madeline. I wanted to pick your brain a little bit more when you talked about the Food Advisory Council. Could you share a little bit more about that? Like how many different restaurants are represented? And then when you have those meetings, what information is gleaned? And then who gets to benefit from it? Does it get shared out to any area restaurants throughout the county that are interested? Does it go out to everyone no matter what? What kind of information is put in it?
So I can get you the information of like who's on it, because I can't remember off the top of my head. But I can say they just had like an initial meeting. So it's been a number of years. I want to say like 10 years since we've had that industry committee. And so they're building it from scratch. So none of that has been determined yet. And so they're kind of trying to define like what their goal is, what they would like. If it is specific training or information, say for staff, getting that feedback so that then that could be provided to all of the area establishments or food service workers. But like how that's defined and how it's going to work yet, they haven't built out, but we're trying to let all of the people at the table who want to participate and volunteer to participate, build that, of what they would like it to accomplish. And if it's a sounding board for issues or concerns or training and education, it's just not been built
Sure.
yet. But I can report back once
That'd
we
be
kind of
neat
have that
to-
little bit more defined.
My other question is, do you know, is that something that I remember seeing, I believe, as one of our committees listed on our website? Is that one that in the past, like a commissioner sat on?
That is for the like enforcement committee, I believe.
Okay.
That is the one that is on the website.
Okay.
And so that's for if we have establishments that get all the way to the point where there might be facing a license revocation. And that does have commissioners sitting on it. And then I believe Corporation Council and members of industry.
Okay,
So,
different.
yep,
Okay.
yep.
just making sure I understood that it was separate from that. Okay, that's my question. So thank you.
I just wanted to quick circle back with the Food Advisory Council. So is that kind of like health department citation prevention, basically, or encourage people who are restaurateurs that have received citations?
We,
Come and
a lot of the
participate.
ones that, I would say a lot of the, probably the restaurants that participate are probably not ones that have a lot of citations. They're like really involved. And so I think it's more of, we want feedback of like what's working for an inspection, like times, like how we're doing our job. We want that feedback.
Mhm.
But then we also want feedback of how we can help with, there's usually a lot of turnover in restaurant staffing. How can we help with make sure their workers have the adequate food safety training and education and partners so that we're preventing where we align is we may have like different goals. Like we want to prevent anybody in the public from getting sick because we want to prevent the spread of illness, but and certainly most restaurants don't want to make somebody sick, but also it's very much aligns with their business goals, right? They
Mhm.
can't run a successful business if you're making people sick. So we try to find that line of how we can work together to best meet that.
Yeah, I wonder if there's an opportunity to share best practices
Mhm.
too, especially if you do have people, restaurateurs that are engaged and wanting to do things well.
Mhm.
Yeah.
Yeah.
To share with those who have struggled. So,
Yes.
Yeah.
Yep. It's a good idea.
All right, any other questions? Nope. All right, thank you. Okay, as we moved to the end of our committee reports, we now have our second opportunity for public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make a public comment? Good morning.
Morning. Lori Grassman, Robinson Township. More or less, I guess I want to praise Dr. Bashir's. Since he's come on board as a special needs mom, wondering what that world looks like, he has been incredibly transparent. He has been incredibly knowledgeable and willing to show the public exactly where things are coming from, what needs to be fixed, is good. Because I've been in this world for 25 years and I had no idea what Haley's Medicaid went towards. In fact, I happen to be one of those parents that have about $150,000 to $200,000 coming into this county every year, and I receive nothing. I have no services for her. I have no options. Truly, she will graduate this year out of Ottawa Area Center. And being she is so severe, I have 2 options going forward because she is incontinent. I don't have anything else. So like when Barbara Van Orsen stands up here and says she helps everybody, she does not. That is a lie because she wouldn't accept mine into her facility. And so I think that just knowing where these funds go and knowing how I can best advocate for her with the funds and the grants in the areas, it's very amazing to have a transparent director because I've dealt with the previous director for many years and gotten nowhere. So I just wanted to thank Gretchen specifically for all of the work she's done and the whole council for bringing a very solid integrity man forward to show the transparency because everybody throws that word around, but nobody actually does it. And he seems to be doing it. Thank you.
Thank you. Are there any other public comments? All right, seeing none, as the adjournment is at the call of the chair, I call this meeting adjourned.
The finance meeting will begin at 10:25 by the clock here on the wall.